What should you do if your insurance denies to pay for IVIG or to cover IVIG? So I'm Dr. Scott Antoine, and I have a practice called the Center for Fully Functional Health with my wife, Dr. Ellen Antoine. We are in Carmel, Indiana. And so the group of patients that I see primarily are children with PANS and PANDAS. And it's only about 10% of our patients. We found lots of helpful modalities for helping children with PANS and PANDAS, but there are about 10% of the patients that I see with PANS and PANDAS that require intravenous immunoglobulin. IVIG, or intravenous immunoglobulin, is an infusion that children and sometimes adults get. You get it over a 2-day period, and it's there's a very precise method by which that's given to people. There are several pre-medications, and then there's a specific way that it's given, IV fluids, other things. It's a very, very specific, tightly controlled process. And so most patients tolerate IVIG okay. They sometimes will get a headache or nausea, but we send patients home with medicine in case that happens. But the thing to know about IVIG is that IVIG is about $25,000 for a 2-day infusion. That's the cost from the drug manufacturer. And so obviously many patients don't have that money, so they put this claim through their insurance. Now you would assume that your insurance would want you to get the very best care, but like with many things with PANS and PANDAS, IVIG itself is a controversial topic. Now, it's a shame because there's an awful lot of clinical literature on intravenous immunoglobulin. So if you look, there are studies which go as far back as 1999, which show improvement in children with IVIG who have PANS and PANDAS. And so that literature chain has continued from 1999 through the 2000s through the present day. There are likely, I think, probably at last count, about 12 articles supporting the use of IVIG in children with PANS and PANDAS. And so what's interesting is several years ago, when we would send orders for IVIG, the insurance companies would send a letter back that said PANDAS doesn't exist. Well, they've kind of learned, probably due to my writing and the writing of many, many physicians all over the country, providing them with literally 50 articles about PANS and PANDAS, from the molecular biology of it to the immunology of it to the neurology of it, looking at all of those things. So now they've begun saying, okay, it's fine, PANDAS and PANS exist, but IVIG is experimental and it's not approved and it's never been shown to work. So these are denials I get all the time when I write IVIG from virtually every insurer. So if you found yourself there now and IVIG has been ordered by your provider and it's been denied, where do you go from here? So the first thing to do is to understand that what they're saying is just not, it's factually untrue. So how we answer questions or controversies in medicine is we look at the published medical literature combined with the clinical experience of physicians all over the country. So if you look, as I said, there are many, many articles supporting the use of IVIG in PANS and PANDAS. And then secondly, if we look at the clinical experience of physicians, the most advanced medical care often is performed at academic medical centers. And so Johns Hopkins, the University of Wisconsin, the Massachusetts General Hospital, Stanford, and many other academic centers, community hospitals, and individual physicians have found IVIG to be helpful. And in fact, many times I may have a patient coming into my practice who's previously had IVIG and it's been helpful. So the stamp that's put on many of these cases, which says IVIG has never been shown to be helpful, is really hard to understand when you have a patient in whom it's been helpful. So when you are countering a denial from an insurance company, several things are important. First, you need to get the denial letter and see why they are denying it. Sometimes it's just because they want some additional lab testing, and that's relatively easy to overcome. But most of the time, it's because they say that IVIG has not been shown to work. One of the other objections sometimes from an insurance company is they'll say IVIG is not FDA approved for pandas. It's absolutely true. Yeah. So it might surprise you or not to understand that 40% of the medication use, things that physicians prescribe, medications for are not FDA approved indications. In fact, many of the medicines we use in pregnant women, they do fine with, have never been studied in pregnant women. We don't make it a thing to do to study pregnant women and sort of experiment and give them medications and see what happens. So much of the things we use for them have not specifically been studied in pregnant women. And so physicians all the time use medications off label, it's called, or without an FDA approved indication. And so you need to know why it's being denied. The second thing is you need to know what the next steps are. So often the first step when you receive a denial is to do a peer-to-peer conference. And so I do these all the time. It takes a significant amount of my clinical hours at work is to do peer-to-peer conferences. I've even done them on days off. And so what to know about these is, well, first of all, often it's not a peer that's calling you. So it's not a similarly trained physician. It can be a physician from another, specialty, OBGYN, or that has no experience with people with neuropsychiatric disorders, or less experience, I should say. So that happens. Sometimes they will have a pharmacist call me and discuss it, or they'll just have a technical person call who has no medical training at all, and they're sort of reading out of a book. So when you have the peer-to-peer, I think it's important from a neurolinguistic standpoint. I will always start off by I'm pleasant on these calls, even though it rubs me the wrong way that there are even physicians who deny these claims and these suffering children. But I'll try and be polite and strike up some conversation. I will also try and find something we have in common. Oh, you're from Pennsylvania. I'm from Pennsylvania. And then I will use terms like our patient. I'll say, let's discuss our patient and see if we can help them. The idea of our patient and we is to get the peer-to-peer person interested. So one thing is when you talk to another clinician about our patient, it kind of stimulates something within them that can sometimes help you. But I would say the vast majority of peer-to-peer conferences don't work. So I get maybe 10 to 15% approved on a peer-to-peer. The next step is typically an appeal letter. So you will write an appeal letter, and I have specific drafts of the appeal letter that I write, depending on why things have been not approved. So what's interesting is that if you look at the literature for IVIG, there's a ton of literature for IVIG. In fact, IVIG, the literature behind it, has been so compelling that multiple states in the United States have produced laws saying insurers cannot deny IVIG solely on the basis of the diagnosis of PANS and PANDAS. In fact, I testified and was able to help get this similar law passed in Indiana. There's also a law in Illinois. And I think the last count is maybe 10 states at this point. Multiple other states are attempting to get this approved. But one of my arguments when things are not approved is, look, we live in a state with a legal mandate, so that has to be approved. Insurance companies don't always care about that. And so I'll talk in a few minutes about what to do if none of this works. And so in those situations, and often I'll argue, for example, if I have a patient from Ohio where there is no such law, I will argue in my appeal letter and say, listen, they are being geographically punished. Like you can't say that IVIG doesn't work because multiple states have, based on the weight of the evidence and all of these academic centers that are using IVIG, have passed these laws. So you're geographically punishing your patient. Your same company, if the patient lived a mile into Indiana, would have to pay for this medication. So sometimes that will be helpful. I'll put the state and the state law in there if I'm writing an appeal letter. So typically there are several levels of appeal, and then it will go to an external review organization. So an independent, quote, independent external review organization. And basically the insurance companies say, if this organization says it's necessary, we'll pay for it, no problem. Well, I can tell you the independent review organizations are hired by the insurance company. To say they're independent is absolutely not the case. I have never had one that came back recommending IVIG payment. And in fact, many times they will cite specific references from the medical literature to argue against IVIG, which are actually opinion pieces with no clinical data or studies cited in them. And so it's obvious they are kind of paid for the opinion that they give. And most of the time it gets denied at that case. So when you get to that point, when things have been denied, you have several things you can do. So one of them is you can draw an autoimmune encephalitis panel if any of the markers on there are positive, and there are several different brands, both private brands and other things. If you find some elevated antibodies, you can resubmit orders under the diagnosis of autoimmune encephalitis. Now, this is sort of splitting hairs because PANDAS is a type of autoimmune encephalitis, but many times that diagnosis of autoimmune encephalitis will help get things approved. Other things that can support IVIG are specific antibody deficiency or common variable immunodeficiency if the patient actually has those and meets the criteria for those. Now, what do you do if you get to the end and nothing gets approved and you've refiled or you've tried to do things and get things approved? Well, at this point, typically I'll tell parents to do two things. One is complain to the state insurance commission, actually file a grievance. The second is call their insurance plan and ask for a case manager to be assigned to them. Many times the case managers will know a pathway in which to get this approved. And then lastly, sometimes sadly, go to social media, go to the news stations near you, and you can get people to pick up a public interest story, or you can get things done through social media. We actually had one of our patients post something on a social media site. It went viral, and immediately the insurance company, not wanting bad press, um, gave the family a social worker and said, listen, we will do whatever Dr. Antoine says in terms of IVIG, and then the patient got it approved. So these are just some strategies. So I've written a textbook called The Comprehensive Physician's Guide to the Management of PANS and PANDAS. You can find that at thepandasdocs.com. It's cheaper than Amazon there. And in that book, I've put specifically copies of the IVIG orders I use, which were based on 13 years of experience with hundreds of children, and a review of all the prevalent literature, as well as order sets from academic centers and private physicians around the country. So you'll find my specific IVIG orders in there. Obviously, I'm not providing medical advice in that book, just the way I do things, and you have to use your own clinical judgment to decide what's best for your patients. And then also, I have examples of appeal letters, templates that you can use in the book if you should happen to need to argue for IVIG for one of your patients. There's also some interesting techniques in there from the field of hypnosis and neurolinguistic programming, showing you how to talk to people and be more persuasive in those indications. So I hope this information has been helpful to you. Also, if you go to thepandasdocs.com, you will find a ton of blogs I've written, absolutely free, about almost all things pandas. And you can find us on Facebook at the Pandas Docs, and also on Instagram at the Pandas Docs. So hope to hear from you. Thank you.